Hello, I'm Dr. Martin Wade from London Real Skin. I'm a consultant dermatologist and the medical director, and today we're going to answer your questions about iPixel. Is iPixel painful? Well, if done without topical anaesthetic, yes, it would be painful. So we prepare the skin, clean the skin, but also put on a strong topical anaesthetic, which makes the procedure completely pain-free. Once the procedure is finished, once the topical anaesthetic effect is worn off, the skin does feel a bit warm, a bit tight, but this is a temporary sensation, and I wouldn't call this painful. How soon will I see results after iPixel? Well, initially the skin's going to look worse. You'll see a lot of tiny dots on the skin, so there is definitely some downtime with this procedure. But what happens is the skin starts to expel the areas of damaged skin that we've created with the laser, and then the skin starts to repair itself. So over the first week we get a lot of rough skin that starts to peel off, but by day 7 we're starting to see that dead skin's gone, and we've got the fresh new skin underneath. So reliably by day 7 we're starting to see the results, but the end result actually isn't until 3 months after the treatment, because the procedure stimulates collagen production, which is ongoing for up to 3 months. How many treatments are needed for iPixel? Well, one size doesn't fit all, so it depends what we're treating, the expectations of the practitioner and the client as well. So we can usually predict reasonably well how many treatments we think someone might need. Often it's a one-off treatment in some patients, but sometimes it's a series of treatments up to 6 treatments spaced out with at least 4 to 6 weeks in between. And often we continue doing treatment until we feel that there may be a plateau, and then we feel that further treatments won't give any further improvement, so then we think about what else we can do to help the skin. What is the aftercare for iPixel laser resurfacing? So in the first 24 hours, it's about keeping the skin clean, making sure we don't introduce any infection into the skin, and also avoiding makeup over that first 24 hours. The most important thing after that is sun protection. So we have skin that's repairing itself, that's healing, so we want to make sure that we protect the skin from the sun. So this is either with physical measures or using an SPF 50 or above sunscreen to block UV radiation onto the skin. There can also sometimes be a little bit of swelling initially after the iPixel, so once again cool compresses can help for the first 24 hours, but by the 24-48 hour stage all the swelling subsided, and then it's really also about moisturizing. So the skin has a dry feel to it, and so moisturizing or using a hyaluronic serum, which will hydrate as well, really does help speed up the recovery process. How does iPixel laser resurfacing treatment work? Well, it works by drilling lots of tiny little holes into the skin. So if we think of a computer screen and think of all the pixels, then it drills out some of those pixels, but not all of the pixels. So this then stimulates the skin to repair itself. It does also denature some of the damaged collagen that's in the skin, and the skin starts to produce new, fresh, healthy collagen. The fact that it's a fractionated treatment, meaning we're not treating all of the skin but just small holes in the skin, means the healing time is a lot faster, and it's much safer than the older techniques where we had full facial ablation with a laser. Who is iPixel treatment suitable for? Well, there's many indications for iPixel. We can do a light laser resurfacing to a more heavy laser resurfacing. So this can be for people who've got significant photo damage or sun damage, people who've got acne scarring. We also use it to address pigmentation issues as well. So there are many indications for iPixel. What are the contraindications for iPixel? Well, we don't do this procedure on pregnant or breastfeeding women, and patients who've got a history of keloid scarring we would recommend not doing this treatment on as well. One of the great things about iPixel is it's one of our colorblind treatments, so we can do it on tan skin. We can also do it on all skin types,